morning. I'm Jay. I'm a new nurse. I'll be precepting with you today.
Hi, I'm Ashley. I'm so excited to work with you. How are you doing?
No complaints. How about yourself?
Pretty good. Hey, how do you feel about doing a head-to-toe assessment?
I can do that. No problem.
We just got a new admission in 118. I haven't had a chance to take a look at her yet. And I have to go pass some medication. So if you could do that, and then we could circle back.
Okay, no problem. Anything else I need to know about 118? Just that it's a new admission?
Yeah, I actually haven't had a chance to take a look at her yet.
Okay.
So that would be
All
great.
right. Thank you.
Thank you so much.
Knock, knock. Good morning. I'm Jay. I'm going to be one of the nurses caring for you today. How are you?
Hi, I'm Jay. My name's Melissa. This is my mom, Betty.
Hi, Betty. Hi, Melissa.
Hi. She's been very weak. She hasn't really been eating much, and she's complaining that her right leg hurts her.
Oh, I'm sorry to hear that, but I'm going to perform a quick assessment of you, and then we'll be able to see what's causing your pain, okay?
3426, 2 minutes to surge. 3426.
This is your nurse, Jay.
Yeah, I'm your nurse. Just one moment. I want to look. Hi, okay, Betty. I'm going to just look at your leg and see what's causing you so much pain. Is that okay?
Get out of here.
I'm going to pull the covers back.
Get out of here.
Betty, can I pull the blanket back? I want to look at your leg.
Get out of here.
Oh, I see. Aha! I found a wound.
Go.
So, Ashley, room 118, she's complaining of pain, 10 out of 10 to her right leg. During the assessment, I did note a wound, and she's at least a 15 on the Braden scale.
Oh, wow. Okay. Nobody said anything about a wound. Let's see if that's documented here. Where was the wound at?
Her right calf.
Door team, please call 3426. Door team, please call 3426.
Okay, I don't see anything here. Let's go take a look.
Okay.
Hi, Miss Betty. My name's Ashley. I'm working with Nurse Jay here today. I just wanted to take a quick look at your leg.
They're gonna look at your leg. They're gonna look at your leg, Mom.
Hi, Betty. I brought back reinforcements to look at your leg for your pain, and so we can assess your wound. Is that okay? Don't touch it. Please, Betty, we need
I just
to.
want to take a quick look at it, okay?
This is Nurse Ashley. It's okay. Let them just
Gonna
take a
pull the
look.
sheet down here. Wow. Oh, wow. Okay. Okay, so with a new wound and with her Braden scale, we need to do a wound care nurse consult. All right, so I will show you how we put in the consult.
Hey, look, they're here.
Hi, I'm Ashley. This is Jay.
Hi.
So Jay found a wound on the patient in 118, and I was looking in the record, and it's not documented. And with her Braden scale being kind of risky, we wanted you to take a look.
Oh, yeah. Here, let me take a look here. Yeah, there's nothing documented. Man, she's been here about 36 hours. This should have been done a while ago. Okay. All right. Let's take a look.
All right, would you mind taking her through it? She's precepting today, and I actually have to go put a Foley in.
Oh, are you a new nurse here?
Yes, ma'am.
Oh, I can't wait to tell you about our skin champion.
Great.
Let's go check it out.
Thank you so much.
Yeah.
Knock, knock. Hi, Melissa. Hi, Betty. It's me, Nurse Jay again. I have the wound care nurse, Alicia, here with me. She's going to go over your wound care.
Hi, Betty.
Hi.
You just got here a little while ago?
Yeah.
Yeah.
Mom's been really sleepy and hasn't been eating much, and she's also had a lot of pain in that right leg.
Okay. Let's go take a look at the wound, okay?
All right.
Okay, Mom. They're
So,
just-
Betty, Alicia and I are going to pull back the blanket and look at your leg, okay?
It's okay, Mom. Just let
Thank
them
you.
know. It's okay. They're gonna just look at your leg, Mom.
Okay. I see what we have here. All right. Is that painful for you?
Yeah, that hurts.
Okay. All right. Let's just take a quick look here.
They're gonna help you.
So we have our different stages.
The Health Informatics Journal published a study in 2020 examining the correlation between specific patient elements and acquiring a pressure injury during hospitalization. It concluded that patients with a lower Braden score had a higher incidence of pressure injuries. Poor nutritional status, or NPO status, doubled the risk of hospital-acquired pressure injuries, and patients with increased time in the OR were 3 times more likely to develop a hospital-acquired pressure injury. Knowing which scores required intervention was an issue that we felt needed to be addressed.
And it doesn't seem as though she has any edema. Yeah, this looks like a stage 3. Yeah.
I would agree.
Yeah. Does it hurt when I do this?
Yeah.
Yeah, okay.
Is it gonna fall off?
Oh no. We're gonna get this taken care of for you, okay? All right.
You're gonna be okay?
Oh yes, it's gonna be okay.
Thank you.
You're welcome. Come on over here to our wound care binder that I brought. A couple of things we will go over, but we're gonna take a picture of it. And here's some items. Our bathing and cleansing, some moisturizing, any skin fold management, which we don't need to really do here, and preventative treatment. So let's run to the closet. We'll grab some materials and then we'll go over some more stuff, okay?
Sounds good.
Okay, go. Okay, so the items we're going to need is an antiseptic spray to clean that wound out since it hasn't been cleaned yet.
Okay.
We'll do a nice barrier cream here, and we'll put on, it's called an Optifoam. It's nice and foamy and it will protect it from hurting. And we can write our initials, date and time, so we know like the last time it's been changed.
Sounds good.
And then, since Miss Betty is a small woman, we don't need to use this. But in some of our larger patients, or even if they have like sacral wounds, we have this really cool, it's called a Comfort Glide repositioning product. And what we can do is keep our chuck pad on top, and it helps to, it's like a sliding material, so that it's easy on the skin. There's no shear or tearing or friction, so we don't make those wounds worse.
So if I'm understanding you correctly, we use the Comfort Glide to reduce friction and shear?
Yes, reduce friction and shear, and also for our safety. You know, if we have the heavier patients, we don't want to throw our backs out.
A 2019 study from the Workplace Health and Safety was aimed at determining a link between sliding sheet usage and work-related injuries. The findings concluded that there was a clear reduction in work-related injuries while transferring bedridden patients with the sliding sheets. These sheets were made of a synthetic nylon which reduced friction and shear when moving the patients. These sheets are now available in select units of the hospital. Staff's encouraged to request these be stocked in their unit if they wish to use them.
Okay,
Terrific.
all right, let's go. Hi, Miss Betty. Hi, Melissa.
Hi.
All right, so we have our supplies here for Miss Betty's wound. Okay, so this is a really cool binder. We have them on all our units, and they're all green, and this helps us with skin integrity, how we should be treating it, how we should document it. We had a group of Schoolcraft nursing students come through here and do a wonderful QI project that helped us implement the binders and the skincare champions, which is something I really think you'd be great at.
Terrific.
So, if she were to have compression stockings or any other medical devices on that leg, we would want to remove them for the time being, but we don't have that, so that's good. The Braden scale, since she's on a risky Braden scale, I think she was a 15, that is definitely a reason that we would be keeping an eye out for pressure ulcers. Miss Betty has been lethargic and not really eating that well, so nutrition plays into that. So here's what we do for our wound assessment. We locate the ulcer on the body, and we're going to measure it length by width by depth in centimeters. We're going to look for any undermining or tunneling. We're going to document the color: red, pink, yellow, black, purple, emaciated, warmth, edema, firmness, other assessment findings. We're going to document drainage, if it's dry, if there's small drainage, moderate, heavy, and if there is drainage, the color of that and consistency. Serous, sanguinous, serosanguinous, and purulent.
Understood.
Yeah. We're also gonna look for any odor and document any pain associated, which she seems to be in a lot of pain from it. Next up, we're gonna photograph it. We're gonna take a photo of it. And that needs to be photographed within 24 hours of admission. And that's why I was so worried when I saw that she's been here for 36 hours. Someone should have done that for her already. And that way we can keep an eye on if it changes condition, if it gets
May I
worse.
have your attention, please? Anybody parked out in the main lot in the front of the hospital, please call the operator. Anybody that's parked in the main lot in front of the hospital, please call the operator.
Okay. So that will help us know if there's any changes.
Knock, knock.
Hi.
Hello, Melissa. Hello, Betty. It's Jay. So I just checked the computer and you have been cleared for discharge. So I wanted to come in and give you ladies some education on wound care, okay?
Okay, yeah, thank you. I'd like some education.
Terrific. So these were some of the products that we were using while she was here to treat her wound, and it's already been dressed for today, so that's a good thing. You want to keep this clean and dry, but you also want to use this product for moisturization, okay? So it's a fine balance, all right? Most importantly, to mom's other bony prominences and heels and elbows and her coccyx, you want to take very preventative measures. So you want to use protectants and skin guards, okay?
Okay.
Now, there will be further instructions and more detailed instructions with her final discharge papers, but for now, do you have any other questions?
Yeah, with that, can I get any brochures or?
Yes, I'm going to give you these to take with you now, and then I'll give you more when I come in for the final discharge.
Thank you.
You're welcome.
A 2017 study from the International Journal for Quality in Healthcare considered a number of teaching tools and methods, including verbal instructions, online videos, wound care pamphlets, follow-up phone calls, and video conference calls. The use of TeachBack was essential to ensure comprehension of materials discussed. This was a useful resource regarding discharge education.
All right, thanks, Miss Betty. Thanks, Melissa.
Thank you.
You're welcome.
We're gonna be busy, Mom.
You did such a great job, Jay.
Thank you.
You're welcome. And I'm proud to anoint you a new skincare champion. Welcome to the wound care team.
Working on the unit here at Garden City Hospital, we noticed there wasn't clear reference materials for wound care assessments and interventions. We realized there was a disconnect from the congruence between the hospital wound care policies and the staff's knowledge. Our group worked with the director of wound care here at Garden City Hospital, and she provided us with the hospital's wound care data from January and February. The data showed that in January, the staff was at 100% for admission documentation and the 24-hour photos, but they're below 50% with the discharge information instructions and the 24-hour post-discharge photos. By February, the numbers have also decreased, being at a 20 to 35% decrease for the admission information for documentation and to get the photos. And they were still below average for discharge instructions and the 24-hour discharge photos. The expected outcomes for the nurses would be that nursing education would improve in the following areas. Unit nurses will be familiar with wound care assessment documentation materials. They'll have knowledge on how to use the Comfort Glide transfer sheets and the locations of supplies that are needed. The nurses will have better understanding of hospital wound care policies and procedures. Our goal is to improve the quality of nursing care at Garden City Hospital for existing wounds and skin tears.
For our QI intervention, we decided that more nursing education and having wound care assessment documentation materials on each unit was needed. To collect our data, we printed out surveys and passed them throughout all the units in the hospital. Some unit nurses had time to complete the surveys right away, others were collected later in the day until we had enough to complete our study sample size. This was done pre and post intervention.
Some of the educational tools we used were the wound care binders and the Braden scale. The nursing students helped implement various methods for improving wound care while at Garden City Hospital while working with the director of wound care. We helped implement a skincare champions program and helped recruit nurses for the program. We also helped update and distribute wound care binders to each unit. The binders contain information about staging wounds, the Garden City wound care policy, and information on wound care products that are available in the hospital. The nursing students helped create skincare guideline posters for the clean utility rooms on each unit. We also helped educate the nurses on the importance of using a Braden scale to assess a patient's risk for developing a pressure ulcer and how to correctly intervene in the event that a patient does have a wound. The hospital has also purchased comfort glide sheets for each unit. The sheets make it easier to reposition patients. They are disposable and can be transferred with the patient. We surveyed 30 nurses from various units for the pre-survey and 24 nurses for the post-survey. Upon completion of the pre-survey, we discovered that there were several areas that needed to be improved upon. The nursing students helped implement various methods for wound care. Upon completion of the post-survey and after implementation, the survey results are as follows. Skin care assessments increased by 92%, documentation increased by 88%, follow-up education increased by 54%, pressure ulcer stages increased by 75%, stages reported to the CNO increased by 58%, and the Braden scale increased by 83%.
We determine the parties that will be affected by the implementation project as the patients, the nursing staff, such as floor nurses, wound care nurses, the CNO, etc., and the physician. The most common barrier across the board has been not having enough time to do a proper skin assessment. Floor nurses on the med-surg and step-down units are stretched thin and overloaded. Lack of education on wounds, for example, not knowing that the correct Braden scale for which a skin assessment should be performed, or providing the patient with adequate education at discharge. Also, attitudes towards adding skin assessments to the forefront of overall patient care.
The QI process maintained patient confidentiality as well as nursing staff confidentiality. We did this by conducting anonymous surveys. Patients and nursing staff were assigned specific numbers as to not violate any HIPAA rules or regulations and to preserve patient and staff confidence. While conducting the survey, infection control precautions were strictly maintained. Students wore both N95 as well as surgical masks. Hand hygiene measures were implemented as well. We assessed the current policy of standards of care to conduct our pre and post survey. Based on current policy to ensure standards of care are set forth by the facility. The approval for the QI project was well received by the organization. The group worked closely with Wound Care Director Anisha. While working with the Wound Care Director, we performed implementation to the standards of care, and this also was a very smooth process. This was very well received and receptive to staff. They enjoyed our new ideas and preventative interventions related to the QI project. The staff felt that this will help provide better overall care and patient satisfaction.
After completion of the QI process, we determined that our project was successful in educating the nursing staff at Garden City Hospital. Our recommendation is for the staff to maintain the wound care binder on every unit, implement skincare champions, and to execute continuous education around wound care policy and procedure. The nursing and leadership staff have been encouraged to continue to use the wound care binder on each unit that we created for them. We also encourage that the hospital provide regular training sessions dedicated to wound care. Expected long-term outcomes of project continuation include increased knowledge and implementation of wound care assessment, including when to complete and how often wounds should be assessed, proper documentation, staging of pressure ulcers, and when to report a wound to the CNO.